Hi, this is Dr. Cunningham, and I have some more information I'd like to share with you. Today, we're going to focus on medication. Now, I want to make sure that I highlight I am not a psychiatrist. I am not able to prescribe medication. This is simply information based on what I've studied through clinical research and also working with clients who have also utilized medication. And specifically, I'd like to address psychotropic medication, whether it's chemical-based medication or actually natural or herbal homeopathic medication or medicine. Now, I need to make it clear that chemical-based medication for psychotropics or any other medication at that effect is actually mimicking something that's natural that already grows in the earth. The difference is that it's lab created and the effective ingredients are measurable and consistent with every dose. So I need to make that clear because, for example, let's say if someone decides to utilize a particular plant in order to heal, say for example, a burn on their skin, you're not sure from the plant itself how effective one leaf of the plant is for the burn, which is very different than if there's a chemical-based medication that actually soothes burns. So you know the exact amount for each dosage that has the desired effect regarding that particular medication. Why is this important to know? Because I recognize that there's some individuals and families or parents who are not comfortable as adults or for their children to take chemical-based medication. Now, if it's something that can be managed as far as their mood or mental health through strategies that you learn through talk therapy, then utilize the strategies. At the same time, if you find that you need additional support, it is okay to take medication. Now, here is some tips. Now, it's important to make sure that when you meet with a psychiatrist, if there are particular medication that they are suggesting, that you ask them, what are the side effects? What is the benefit of the medication? What's the minimum amount I can start with? Because you want to make sure that you're taking the appropriate medication for the appropriate effect and not being over-medicated. If you happen to feel drowsy or not like yourself, or maybe you start feeling sick, you need to make note of that and make the psychiatrist aware immediately. Now, every psychiatrist is supposed to start off with an evaluation, which means that they're going to diagnose what the concern is before they prescribe a medication. It's very important to be aware of that. But also make sure that your diagnoses are going to be consistent, because sometimes psychiatrists and a therapist may have different perspectives regarding what the concern is. At the same time, make sure that the medication is addressing the symptoms in which you've gone into the office for the concern. And if it may be different than what you thought it was, make sure that you trust the psychiatrist. Have them explain as thoroughly as possible what medication you're on, for what reason, how is it going to help you, what are the red flags as far as adverse effects. And then you need to make sure that you tell them each and everything that you consume that may be medicinal. And now this is information even for those that might be cannabis users. You need to tell them that. Because again, natural medicine or homeopathic remedies or anything that is consumed that actually grows from the earth and chemical-based medications can interact. So if you're trying to, work on your focus or feel as though you're dealing with some anxiety and are using THC or cannabis, you need to tell your psychiatrist, because that's going to actually help them to be able to determine what medication you can utilize. And they will be able to tell you the potential of the interaction, which may change the chemical-based medication that they even suggest. Now, I also want to let you know that, again, just like I said from the beginning, there are natural remedies that exist that grow naturally in the earth. And I'm not here to promote THC. I'm not talking about that at all. But what I am saying is that there's certain things that you can find even in a natural food store or in a natural medicine store where you can buy them right over the counter. For example, Bacopa, I consume that sometimes and it actually helps with focus. There's also Brillia, Brillia, that you can purchase that is a homeopathic medicine for ADHD or ADD. And there are also a number of other natural remedies to assist with reducing angst. For example, like ashwagandha. A lot of people know about that one. At the same time, these are things to keep in mind. Or maybe sometimes when feeling a little low on energy, maybe doubling up on a dose of B complex is quite helpful. Again, it's a vitamin. So these are things you're able to keep in mind. Again, I'm not suggesting this information from the perspective of my scope of practice as a therapist. However, from my experience as a therapist, there's certain educational information I can share with you that I'm hoping can be a benefit to you. So keep in mind, whether you decide to use chemical-based medication or natural medicine, make sure that your doctors are aware of all of the medicine that you are consuming and for what reasons, because they can have interactional effects. And with consideration of even what you consume as far as alcohol. You need to be aware of that. Make sure your doctors are aware. And then listen to what your doctors are saying. Again, if you feel as though you're being misled as far as the information because you're not noticing a positive difference, then it's okay for you to consider another provider. But I would suggest making sure that you have a conversation with that provider before you decide to move on. So you can make sure that you have followed as they have prescribed, and or also letting them know how it is affecting you, because it's important for a patient or client and providers to have open lines of communication for your well-being. So I trust you all have a great one.